Healthcare changes. Healthcare is always going to change, and we're never going to be perfect. We're never going to get it always right, and we have to be always asking, well, how can we do this differently, and how can we do it differently next?
The key challenges are the various bottlenecks that we face. So, one, the bioinformatics curation is getting better and better, but we've still got a way to go there. So that's one of the challenges. A second challenge for me is how do we roll this out and fund it in an equitable manner?
Yeah, I think the other things that I would add to that, and I did agree with everything that John said, was are probably the workforce limitations that we're already seeing, and especially this applies particularly, I think, in the mainstreaming area. If we are to move genomics technologies into other areas, we will need more of that bandwidth, both in genetics and in counselling. And the answer to this is probably not just employing more people or training more people, but will also be very much created by education and by automation.
And so we do need to sell ourselves better to the general public by showing that we can deliver. So if we keep telling them, okay, we found this gene for diabetes and that gene for asthma, and we know that these findings are not yet actionable, then we will have a gap between what we're claiming and what is being delivered as, actionable data to people that they feel is, influencing their management and their healthcare.
The most important thing that we need to be tackling is to really be very self-critical of what we can and can't do currently. Take a step back from what we're doing and ask the question, if we had genomic evaluation, genomic interrogation, genomic scale testing, are there questions we could answer that we're not currently answering? And I think the answer to that is an unambiguous yes.
So genomics is also helping us to unveil that, yes, we can provide new explanations, genetic underpinnings, but also we can realise, well, there are things that we've been able to do that have helped too, and we can now start reaching for the stars and actually having treatments that are directed, and that's something that we never knew before. You can't treat things you don't understand.
So for me, I'd like to think that in 2 years' time, we'll actually have our first set of genomic tests funded by either a national or a shared national state governmental pot. I think we'll be able to crack that one in the next couple of years.
The thing I'd add to that would be, and this may be ambitious, is that in 2 years I would like to see that all next generation sequencing based data in clinical genomics laboratories is shared between labs.
Trying to move forward things with functional testing, links with laboratories, and then completing the circle with functional testing potentially throwing up novel treatments and coming back to the clinic. I think we need to start those processes happening, and hopefully that's the future, because that's the aspect that's going to improve outcomes for our patients.
In 2 to 5 years, I think that we'll probably be able to use sequencing, genomic sequencing, more broadly than we currently are for patients who clearly have genetic disorders. But what I'm even more excited about is just to use it very broadly and actually find patients who we don't even currently today realize have a genetic disorder, because that then breaks that old paradigm of thinking patients have to get sick before they get health care. Because if we can treat them before they get sick, we can have the best opportunity to keep them healthy.
I would like to think we will have more evidence of direct benefit. Presuming that there is benefit without the evidence to back it up is no longer going to be acceptable. So I think identifying evidence of benefit, and through that will drive system change. But how it actually happens, I think, is really difficult to say. I'd like to be part of whatever this revolution is, along with obviously many of my colleagues who are here today. And the one thing the last few years has taught me is that it's going to change in ways we can't predict.